Dashboard. Alrighty, well, thank you everybody for joining us today. My name is Andrew Dauphney. I'm the Instruction and Outreach Librarian at the New Jersey State Library, and it's my pleasure to present our speaker for today, Mr. Marcial Hernandez Jr., Public Affairs Specialist for the Social Security Administration. He is responsible for the SSA's community outreach and engagement throughout New Jersey. Mr. Hernandez's career with the SSA spans 22 years, during which he has worked with community-based organizations, advocacy groups, and the staff of federal, state, and local elected officials and agencies to increase public awareness about Social Security, supplemental security income, the issuance of Social Security numbers, and how to enroll in traditional Medicare. So welcome so much. Glad that you could speak with us today. Before we jump into the presentation, I just have a few housekeeping items to go over. First and foremost, we will be taking your questions at the end of the program today, but please feel free to submit them at any time using the Q&A or the chat feature. Once the program gets underway, I will be sending some handouts into the chat with some more information, so please feel free to download them. If you have any problems downloading them, don't worry, they will be sent in a follow-up email as well. As always, we have a survey after the webinar, so if you have time, we ask you please complete that. We always love hearing your feedback. And on the screen right now, you can see that there is an address for the Social Security Administration. So if you do have any questions or you kind of want to explore things on your own or looking for more information, you can find everything at www.ssa.gov. One last thing before we jump in, I just want to do a brief tutorial of the Zoom dashboard. This is what your dashboard should look like if you're using a PC or a Mac. If you're using a mobile device, your dashboard may look a little bit different, but all of the features will still be there. In the bottom left-hand corner, you will see your audio settings. So you can check if you are using an external listening device to make sure that it's connected properly. At any point during the program, if you have any problems, there is a raise hand button here. You can click on that, that'll alert me, and I'll get in touch with you in Zoom and hopefully be able to resolve any issues that you are having. And as I mentioned, if you do have a question, please feel free to post it in the chat or use the Q&A function, and we'll be happy to address them at the end of the program. So that is everything that I have for you. So it is my pleasure now to turn it over to Marcial.
Thank you, Mr. Dauphney. Okay, thank you for having us and presenting this presentation for you on retirement, Medicare, and online services. And again, my name is Marcial Hernandez Jr. As he stated, I've been in the agency for over 22 years. I served as a claims representative, and I then moved on to management, and then I was blessed with this job as being a public affairs specialist and being able to reach out to the public and give them the information that we give them and make sure they have a connection. So with that said, remember this event is public. Please do not share any personal information such as your date of birth, Social Security numbers about yourself or any others during the presentation. You can either email me later on or I'll give you my information at the end of the presentation. You can contact me directly if anything. So with that, let's take it away, Andrew, with first slide.
Okay.
Okay, the first slide says welcome, and again, welcome, and then we're going to go on to the second slide, which is Social Security with you through life's journey.
Yep.
Okay, so for nearly 90 years, Social Security has helped secure today and tomorrow by providing benefits and financial protection for millions of people throughout their life's journey. Social Security touches the lives of every American, both directly and indirectly. As you consider the information that you're about to receive, I encourage you to think about all the ways Social Security has been linked to your life and the lives of your loved ones. Next slide.
Okay.
Other income, savings, and investments, pensions, Social Security. Social Security was never meant to be the only source of income for people when they retire. Social Security replaces a percentage of a worker's pre-retirement income based on your lifetime earnings. The amount of your average wages that Social Security retirement benefits replaces varies depending on your earnings and when you choose to start benefits. If you start benefits in 2023 at your full retirement age, okay, this is percentage ranges from as much as 75% for the very low earners to about 40% for the medium earners, to about 27% for maximum earners. If you start benefits after full retirement age, these percentages would be higher. If you start benefits earlier, these percentages will be lower. Financial experts say you'll need 70 to 80% of your pre-retirement income to live comfortably in retirement. Next slide.
Go ahead.
Okay, how do you qualify for retirement benefits? Credits are the building blocks Social Security uses to find out whether you have the minimum amount of covered work to qualify for each type of Social Security benefit. If you stop working before you have enough credits to qualify for benefits, your credits will stay on your record. If you return to work later, you can add more credits so you can qualify. No benefits can be paid if you do not have enough credits. In 2023, you must earn $1,640 in covered earnings to get one Social Security or Medicare work credit and $6,560 to get the maximum 4 credits for the year. When you work and pay Social Security taxes, you earn up to a maximum of 4 credits for each year. During your lifetime, you will probably earn more credits than the minimum number you need to be eligible for benefits. However, these extra credits do not increase your benefit amount. Your average earnings during your working years determine how much your monthly payment will be. Okay. Next slide.
Okay.
Benefits chart by age. Remember that when you start receiving retirement benefits, it's a personal choice. There isn't a one-fits-all answer. You should make an informed decision about when to apply for benefits based on your individual and family circumstances. Factors you should consider when deciding the best age to retire should be your current cash needs, your health and family longevity, whether you plan to work in retirement, whether you have other retirement income sources, your anticipated financial needs and obligations, and the amount of your future Social Security benefits. This chart gives you an example of how much a $1,000 retirement benefit and a $500 retirement benefit would be reduced if someone took the benefit at age 62. The increase in full retirement age was the result of a 1983 amendment to the Social Security Act. Full retirement age increases apply to both retirement benefits and survivor benefits. Although Social Security has always used the term full retirement age, you may find that some people now refer to full retirement age as the normal retirement age. Regardless of your full retirement age, reduced benefits can still be paid as early as age 62. In addition, the Medicare eligibility age of 65 has not changed. We recommend that you apply for Medicare 3 months before your 65th birthday, unless you're already receiving Social Security benefits when you turn 65, in which case you will be automatically enrolled in Medicare. Next slide.
Okay.
How Social Security determines your benefit. Credits are based on your total wages and self-employment income during the year. No matter when you did the actual work, you might work all year to earn 4 credits, or you might earn enough for all 4 in a much shorter length of time. We are looking for the highest 35 years during a worker's lifetime of earnings, regardless of when you earned it. Using this formula means that a worker who qualifies for retirement benefits with just 10 years of work would have a lower benefit payment than someone who worked longer. That's because we're looking at the highest 35 years of earnings. In this example, there would be 25 years with 0 earnings. Okay, next slide.
Okay.
Retirement calculator. You can use the online retirement calculator at ssa.gov/benefits/retirement/estimator.html to get immediate and personalized benefit estimates to help you plan for your retirement. It's a convenient, secure, and quick financial planning tool. The retirement calendar is an interactive tool that allows you to create what-if scenarios. You can, for example, change your stop work dates or expected future earnings to create and compare different retirement options. Next slide.
Okay.
Social Security online calculators. We offer a variety of calculators to help you with your retirement planning. Just choose the one that best fits your needs. When you visit our website, be sure to scroll down to the near bottom and click the Calculators button. Okay, next slide.
Okay.
Working while receiving benefits. The first thing we recommend is that when you visit ssa.gov/pubs, PUBS, and search for the publication entitled How Work Affects Your Benefits. It explains the rules you must follow in order to avoid an overpayment, and it gives some great examples for different scenarios that could apply to your individual situation. You can get Social Security, retirement, or survival benefits and work at the same time. However, if you're younger than full retirement age and earn more than certain amounts, your monthly benefit remains the same, but the total amount of benefits you receive for the year will be reduced. The amount that your annual benefits are reduced, however, isn't truly lost. Your monthly benefit will be increased at your full retirement age to account for the benefits withheld due to earlier earnings. Note that spouses and survivors who receive benefits because they have minor or disabled children in their care don't receive increased benefits at full retirement age if benefits were withheld because of work. I should also mention that different rules apply if you work outside the United States. Just contact us if you're working or plan to work outside the country. But for most of you, here's how this works. If you work and are at full retirement age or older, you may keep all your benefits no matter how much you earn. If you're younger than full retirement age, there is a limit to how much you can earn and still receive full Social Security benefits. If you're younger than full retirement age, we must deduct $1 from your benefits for each $2 you earn above the annual limit. And that limit for 2023 is $21,240. Okay? If you reach full retirement age during 2023, we must deduct $1 from your benefits for each $3 you earn above $56,520 until the month you reach your full retirement age. Starting with the month you reach full retirement age, there's no limit on how much you can earn and still receive all of your Social Security benefits. Note, if some of your retirement benefits are withheld because of your earnings, your benefits will be increased starting at your full retirement age to take into account those months in which benefits were withheld. Okay. Next slide.
Okay.
Benefits for a spouse. A spouse who has not worked or who has low earnings may be entitled to as much as 1/2 of the retired worker's full benefit. If you're eligible for both your own retirement benefits and for benefits as a spouse, we always pay your benefits first. If your benefits as a spouse are higher than your retirement benefits, you will get a combination of your benefits equaling the higher spouse benefit. If a spouse wants to get Social Security retirement benefits before they reach full retirement age, the amount of the benefit is reduced. The amount of reduction depends on when the person reaches full retirement age. The benefit is unreduced if the claiming spouse is caring for a child who is under the age of 16 or who is disabled. The benefit is only payable if the claiming spouse's own unreduced benefit rate based on their earnings history is less than 50% of the worker's unreduced benefit rate. The claiming spouse must file first for their own benefit based on their earnings history, which is subtracted from the full spousal benefit. Next slide. Benefits for divorced spouses. Your benefit as a divorced spouse is equal to 1/2 of your ex-spouse's full retirement amount or disability benefit. If you start receiving benefits at your full retirement age, the benefits do not include any delayed retirement credits your ex-spouse may receive. If you remarry, you generally cannot collect benefits on your former spouse's record unless your later marriage ends, whether by death, divorce, or annulment. If your ex-spouse has not applied for retirement benefits but can qualify for them, you may receive benefits on his or her record even if you have been divorced for at least 2 years. If you're eligible for retirement benefits on your own record and divorced spouse's benefits, we will pay the retirement benefit first. If the benefit on your ex-spouse's record is higher, you will get an additional amount on your ex-spouse's record so that the combination of the benefits equals that higher amount. Okay. Next slide.
Okay.
Deemed filing. If you were born on or before January 2nd, 1954, and are at least full retirement age and qualified for your own retirement benefits and also spouses or divorced spouse benefits, you can choose to restrict your application, apply for one of the benefits, and delay applying for the other until a later date. You may have heard or read about the various filing strategies available to married couples when it comes to Social Security, retirement, and spousal benefits. Due to a change in the law, some of those options are changing. The first change in the law says that now, if you become eligible for Social Security benefits both as a retiree and as a spouse or divorced spouse, and you want to go ahead and claim your benefits, you must file for both benefits. This is called deemed filing, and it is used to apply only prior to full retirement age. Based on the law change, deemed filing now applies at any age for people who turn 62 after January 1st, 2016. However, there are 2 exceptions to the deemed filing provision. We have child and care benefits, is when a beneficiary is entitled to spousal benefits based on a child and care requirements and is eligible for retirement benefits. He or she may delay filing for retirement benefit. Then there's receiving both disability and spouse's benefits. When a beneficiary is entitled to disability and spouse's benefits, he or she may delay filing for retirement benefits. If the disability benefits terminate before converting to retirement benefits, deemed filing applies in the month of termination of the disability benefit. You can find more information and details about this at ssa.gov/planners, that's PLANNERS/retire/deemed, DEMEDFAQ.html. Next.
Okay.
Voluntary suspension. The second change in the law involves what we call voluntary suspension. If you take your retirement benefit and then ask to suspend it to earn delayed retirement credits, your spouse or dependents, excluding divorced spouses, generally will not be able to receive benefits on your Social Security record while your own benefits are suspended. In addition, you will not be able to receive benefits on anyone else's record during that time. We know that some of these rules can be confusing, so we encourage you to visit our website for a comprehensive explanation and see how some specific examples that illustrate how this plays out for married couples. And again, you can visit ssa.gov/benefits/retirement/suspend.html for more information about voluntary suspending your benefits. Next slide.
Okay.
Survivor benefits. Let's take a look on how people become eligible for Social Security survivor benefits. A child may receive benefits on a deceased parent's record if he or she is not married and is under the age of 18 or between ages 18 and 19 and a full-time student no higher than grade 12. A disabled child may receive benefits beyond 18 if he or she is not married and was disabled before the age of 22. A widow or widower or divorced widow or widower may receive full benefits at full retirement age or reduced benefits at age 60 or as early as age 50 if they are disabled, or at any age if caring for a child under the age of 16 or disabled child. The length of marriage requirement for a widow or widower to be eligible for benefits is 9 months, and for a surviving divorced spouse is 10 years. There are exceptions to the duration of marriage requirements. Generally, you cannot get widow or widower benefits if you remarry before the age of 60. But remarriage after age 60 or age 50, if you are disabled, will not prevent you from getting benefit payments based on your former spouse's work. Also, at age 62 or older, you may get benefits on your new spouse's work if those benefits will be higher. Next slide.
Okay.
Continuation of survivor benefits. Let's talk about how survivor benefits are calculated. Your surviving spouse can claim survivor benefits once they reach age 60 or age 50 and older if disabled. If they start receiving survivor benefits at age 60, they will get 71.5% of your basic benefit amount. The longer they wait to start benefits, the higher the percent they receive, up to 100% of your basic benefit if they begin receiving survivor benefits at their full retirement age. If you waited until past your full retirement age to start receiving your retirement benefits, the amount your surviving spouse receives will be based on that higher benefit amount. This is general information, and there may be other factors based on each person's situation. Next slide.
Okay.
Auxiliary benefits for children. Your unmarried child can get benefits if they are younger than age 18, between the ages of 18 and 19, and a full-time student, no higher than grade 12, or age 18 or older with a disability that began before the age of 22. There are certain circumstances we can also pay benefits to a stepchild, grandchild, step-grandchild, or adopted child. Within a family, a child can receive up to 1/2 of the parent's full retirement benefit or disability benefit. If a child receives survivor benefits, they can get up to 75% of the deceased parent's basic Social Security benefit. There is a limit to the amount of money we can pay to a family. The family maximum can be from 150 to 180% of the parent's full benefit amount. If the total amount payable to a family member exceeds this limit, we reduce each person's benefit proportionately. except the workers, until the total equals the maximum allowable amount. Okay. Next slide.
Okay.
Okay. If you begin receiving survivor benefits, we recommend that you contact us at age 62 to see if you are eligible for a higher benefit on your own record. If we calculate your retirement benefit and it is lower than what you are already receiving as a survivor, then we're not going to switch you over to the retirement and reduce your monthly benefit. Remember, retirement and survivor benefits both fall under the same umbrella of financial protection offered by Social Security. However, if we calculate your retirement and it is higher than what you are already getting as a survivor, you have a choice. You can either switch over immediately for the higher monthly payment, or you can stay on survivor benefits and switch over to retirement later on down the road when something comes up and you need more money coming in, or as late as age 70 if you want to completely max out your retirement by getting all possible delayed retirement credits added to your calculation. Just contact Social Security to find out if you can switch to a higher benefit amount. Social Security Administration will review your individual situation and make a determination. Next slide.
Okay.
Other survivor benefits. We also have two other types of survivor benefits. First, a surviving spouse or child may receive a one-time lump sum death payment of $255 if they meet certain requirements. You may have seen misleading TV advertising that implies that the only benefit payable is the lump sum death payment, when in fact there may be a monthly widower, or child benefit available. The other survivor benefit is a parent's benefit for a parent who is at least age 62 and was receiving at least one half of his or her financial support from their child who died. Although parents' benefits are included in our survivor benefit program, the number of people who receive parents' benefits is relatively small. Next slide.
Okay.
Spouse versus surviving spouse benefits. Note, divorced spouses qualify if marriage lasted at least 10 years and other conditions are met. Here's a side-by-side comparison of spousal and survivor benefits. The worker and their spouse must be married for 1 year continuously, immediately before the day on which the application is filed. Note, the 1 year requirement can be waived if the spouse is the natural mother or father of the worker's biological child, or if the spouse was entitled or potentially entitled to certain auxiliary or survivor's benefits in which month before the month of marriage to the worker. If a spouse is caring for a worker's child who is under the age of 16 or disabled receiving child's benefits, the spouse could qualify regardless of age. When a spouse is under full retirement age, no longer has a child of the worker who is under the age of 16 or disabled in their care, the spouse's benefits will stop unless they choose to receive reduced spouse's benefits. Next slide.
Okay.
How to apply for benefits. You can apply for your Social Security within 4 months of when you want your benefits to begin. You have 3 options. When it comes time to file, first, you can apply online at ssa.gov. This is the most convenient way to apply. Then you can either call Social Security to schedule an appointment to apply over the telephone on a day and time that is convenient for you, or call the Social Security office to schedule an appointment to apply in person at your local Social Security office with a face-to-face interview. You cannot file online for auxiliary child's benefits, disabled adult child benefits, or survivor benefits. Applying online is still the most convenient way to apply for benefits. You can apply for retirement benefits in as little as 15 minutes. Next slide.
Okay.
Will I pay federal taxes on my benefits? No one pays federal taxes on more than 85% of his or her Social Security benefits based on Internal Revenue rules. At the end of each year, we'll mail you the Social Security benefit statement, which is a Form 1099, showing the amount of benefits you received. Use this statement when you complete your federal income tax return to find out if you must pay taxes on your benefits. Although you're not required to have Social Security withhold federal taxes, you may find it easier than paying quarterly estimate tax payments. For more information, you can read the Tax Guide for Seniors, which is an IRS publication number 554, and Social Security and Equivalent Railroad Retirement Benefits. It's also an IRS publication number 915 that you can find at irs.gov/publications. Or you can call a local Internal Revenue Services toll-free number at 1-800-829-3676. Note, on your 1040 tax return, your combined income is the sum of your adjusted gross income plus non-taxable interest plus half of your Social Security benefits, which is shown in the next slide. Next slide.
Okay.
Taxation of Social Security benefits. It has a publication, 554, and publication 915. Okay. Next slide.
Okay.
Medicare card. Medicare cards have a Medicare number instead of your Social Security number. Older cards with Social Security numbers are no longer accepted. If you need a Medicare card, just contact Medicare at 1-800-MEDICARE, which is 1-800-633-4227. They also have a TTY number, which is 1-877-486-2048. Or get a replacement card using your My Social Security account, which we'll go over in a few. Next slide.
Okay.
Medicare. Okay. Medicare is our country's health insurance program for people age 65 or older. People younger than age 65 with certain disabilities or permanent kidney failure or Lou Gehrig's disease can also qualify for Medicare. You have choices for how you get Medicare coverage: Original Medicare and Medicare Advantage. First, Original Medicare. That includes Hospital Part A and Medical Part B insurance. If you want drug coverage, you can add a separate drug plan, which is Part B. You can also add a Medicare supplement insurance, which is Medigap policy, to help pay your out-of-pocket costs. A Medicare Advantage plan is an all-in-one alternative to Original Medicare. These bundled plans include Part A, Part B, and usually Part D. Most plans offer extra benefits like vision, hearing, dental, and more. Medicare has 4 parts. First, Part A is a hospital insurance which covers most inpatient expenses. The 2023 deductible for Part A is $1,600. Then there's Part B, which is the medical insurance which covers 80% of doctor's bills and other outpatient medical expenses after your first $226 in accrued charges. The 2023 standard monthly premium is $164.90. That's $164.90. It went down from last year. There is no monthly premium for Part A. If you're insured for retirement benefits, after you retire, your health insurance may require a Medicare to pay first. Many supplemental plans require you to sign up for Medicare Part B. The Medicare premium most beneficiaries pay represents a quarter of the actual cost, and the federal government covers the balance of the cost. Then there's Medicare Advantage, also known as Part C. It's an all-in-one alternative to original Medicare. These bundle plans include Part A, Part B, and usually Part D. These plans may also have lower out-of-pocket cost and may offer extra benefits that original Medicare doesn't cover, like vision, dental, and more. Then there's Part D, is the Medicare prescription drug coverage, which covers a major portion of your prescription drug cost. Your out-of-pocket cost, monthly premiums, annual deductibles, and prescription co-payments will vary by a plan. You enroll with a Medicare-approved prescription drug provider, not by contacting Social Security. Each Medicare Advantage plan can charge different out-of-pocket costs, but they must follow rules established by Medicare. Medicare-approved prescription drug plans cover a major portion of your prescription drug cost. You can learn more with our publication, Medicare, which is number 05-10043, to learn more about original Medicare, Medigap, or Medicare Advantage plans. Just visit medicare.gov/publications to view the CMS publication Choosing a Medigap Policy, which is publication 02110, and Understanding Medicare Advantage Plans, which is publication 12026. Next slide.
Okay.
Medicare eligibility. Remember that although the full retirement age has increased above age 65, Medicare eligibility still is age 65. One of the most important things to remember is that you can apply for Medicare online, even if you're waiting past 65 to apply for Social Security retirement benefits. You should apply for your Medicare 3 months before your 65th birthday, even when you plan to apply for your retirement or spouse's benefits later. If you're approved for Social Security disability benefits, you will be eligible for Medicare benefits 24 months from the month you were entitled to receive benefits, not from the first month you receive a payment, or when you get to the age of 65. If you're diagnosed with Lou Gehrig's disease and get disability benefits, you can get Medicare right away. If you have a permanent kidney failure and you receive maintenance dialysis or kidney transplant, you may also be eligible for Medicare. Okay, next slide.
Okay.
Medicare enrollment. Medicare has 3 enrollment periods. First is the initial enrollment period, which is IEP. This is a 7-month period that begins 3 months before your 65th birthday, includes the month you turn 65, and ends 3 months after that birthday. Then we have the special enrollment period, which is SEP. If you are age 65 or older, you or your spouse are still working, and you are covered under a group health plan based on that current employment, you may need to apply for Medicare Part B at age 65. You may not need. Okay? You don't need to apply at that point. You may qualify for special enrollment period, which is the SEP, that will let you sign up for Part B at the time you do retire without a penalty for delayed enrollment. Then there's the general enrollment period, which is the GEP. If you didn't sign up for Part A or Part B when you were at first eligible, and you aren't eligible for a special enrollment period, you can sign up during the general enrollment period between January 1st and March 31st of each year. Beginning 2023, coverage begins the month after you enroll. You may have to pay a late enrollment penalty for as long as you have Part B coverage. You can file for Medicare if you're delaying cash benefits, and the health savings account, which is the HSA information. You should not contribute to an HSA if you're enrolled in Medicare, as there may be negative tax implications. Okay? Next slide.
Okay.
Medicare Part B coverage. This chart shows when your Medicare will become effective if you apply during your initial enrollment period. Okay? If you applied it during the 3-month window prior to the month you turn age 65, your Medicare kicks in the first day of the month you reach age 65. So in 2023, if you sign up in your initial enrollment period during the last 3 months of your IEP, which is initial enrollment period, your coverage begins the month after you enroll. Okay. Next slide.
Okay.
Medicare Standard Part B premiums for 2023. Okay. This graphic shows the Medicare premiums for each income bracket. Most Medicare beneficiaries pay the standard premium for Part B of $164.90 a month per month in 2023. It is automatically deducted from their Social Security check if they receive one. If you're not getting a check, they can be billed or have the premiums deducted from a checking or savings account. Now, people with higher incomes will pay more for Part B and their prescription drug plan premiums. This is called IRMA, which is Income Related Monthly Adjustment Amount. We determine whether you pay the higher premium every year, and this is how it works. To decide your IRMA, we ask the IRS for your modified adjusted gross income, which is the MAGI. That equals your adjusted gross income plus certain tax-exempt income from the federal income tax return you filed 2 years ago. For example, your 2023 Part B premium is determined by the MAGI on your 2021 return. If your 2021 tax return is not available, we'll use your 2020 tax return. Now, HSA, which is the Health Savings Account information, you should not contribute to an HSA if you enrolled in Medicare, as there may be negative tax implications. Contact your local tax professional for more information on that. Okay. Next slide.
Okay.
Medicare applications. You can use our website to apply for Medicare Parts A and B, along with the Social Security retirement benefits. Most people apply for Medicare Part A along with their retirement benefits because you're required to enroll for Medicare Part A at the same time you start retirement benefits. Remember, Medicare Part A has no monthly premiums for those who have 40 work credits. If you apply online for Part A only and then refuse Part B, which does have a monthly premium, you can enroll in Part B later anytime you are still, as long as you're covered by your employer's GHP, General Health Plan, or within 8 months after your coverage or employment ends, or during the General Enrollment Period, which is the GEP, which is January through March of the current year. Your Part B coverage starts the first day of the month after you sign up. If you don't enroll in Medicare Part B during your initial enrollment period, you have another chance each year to sign up during a general enrollment period from January 1st to March 31st. Your coverage begins again after you enroll. You can read our Medicare publication for more information at ssa.gov/publications, and that's number EN 05-10043. It's in PDF. If you're already enrolled in Medicare Part A and later you want to add Part B under the special enrollment period, you have 3 options. You can visit our website at ssa.gov/Medicare-Part B-SEP to complete the online application. You can also fax your completed CMS form. There's a Form 40B. It's an application for enrollment in Medicare Part B, medical insurance. And the other form is the CMS L564. It's a request for employment information. And it proves to your local Social Security office. You can refer to HI 805.295, evidence of general health plan or LGHP coverage based on current employment status for secondary proof if the L564 cannot be provided. Lastly, you can also mail your completed forms to your local Social Security office. These two forms are available on our homepage. Just click on the Forms button at the bottom of the page. Next slide.
Okay.
Extra help with Medicare prescription drug plans. Extra help is available for beneficiaries with limited resources and income to help pay for the costs related to a Medicare prescription drug plan. These costs include monthly premiums, annual deductibles, and prescription copayments. Extra help is estimated to be worth about $5,100 per year. You may apply for extra help online, over the phone, or in your local Social Security office. Next slide.
Okay.
Medicare.gov. Please keep in mind that although you apply to Medicare by contacting Social Security, and we have some Medicare information on our website, it is actually another federal government agency, which is called the Centers for Medicare and Medicaid Services, commonly referred to as CMS. And that's where we get that form, that CMS 4B and the CMS L564. This is the program that administers the program. CMS is your main source for information regarding Medicare. Social Security just helps you apply for Medicare Parts A and B, and we send your entitlement information electronically to CMS. We can also take your application for the extra help of Medicare Part D. If you sign up for Part B, we deduct the premium from your monthly Social Security benefit and send it to CMS before you receive your payments from us each month. If you're enrolled in Medicare only, CMS will bill you for your Part B premiums until you go on Social Security. If you have any questions regarding the Medicare program, you can call the CMS at 1-800-MEDICARE or visit Medicare.gov. Again, your state health insurance assistance program, SHIP, can answer any Medicare questions you may have. To get the phone number for your local SHIP office, just visit shiphelp.org. That's SHIPHELP.org. Or look in your Medicare New Handbook. For more information, again, Medicare, please visit Medicare.gov or call the 1-800-633-4227. Next slide.
Okay.
Medicare.gov again. Here we go. Medicare has a free, secure online service for accessing personalized information about your Medicare benefits and services with a Medicare.gov account. It's available at Medicare.gov. After you create an account, you can fill out the initial enrollment questionnaire, which is an IEQ, view claims information, get quality information about your providers, and more. And again, for more information or help with the site, please contact the Center for Medicare and Medicaid Services at 1-800-633-4227. Next slide.
Okay.
Okay, the Social Security website is a valuable resource of information about all of Social Security's programs, and is accessible from a computer, tablet, and even a smartphone. We encourage you to use our online retirement planning tools to plan for a secure financial future. Next slide.
Okay.
My Social Security. My Social Security is a convenient and secure suite of services designed to put you in control of your personal Social Security information, as well as help you manage your benefits when you start receiving them. Your account gives you the information you need at your convenience, or without calling or visiting a local office. You can only open a My Social Security account for yourself. You cannot open an account for another person, even if you have his or her written consent. You may also be unable to open a My Social Security account if you blocked electronic access to your personal Social Security information, recently moved or changed your name, or placed a freeze on your credit report. Your online My Social Security account provides a variety of information to help you and your family. If you need help setting up an account, we have a 4-minute walkthrough video on our YouTube page. Okay, next slide.
Go ahead.
Okay, how to sign in to a My Social Security account. To open a My Social Security account, you have to be at least 18 years of age, have a valid email address, a Social Security number, a phone number, and a United States mailing address. To open your account, go to ssa.gov/my account and select Sign In or Create an Account. If you have a My Social Security account user or password from prior to September 18, 2021, you will continue to sign in with that same username and password. You will also have the option to sign in through login.gov or id.me if you already have an account. If you don't have a login.gov or id.me account, select the Create an Account link to start this one-time registration process. The first Create an Account button will send you to a page where you will need to click Create an Account again. Once you select Create an Account, it would automatically direct you to the login.gov. This is the page that shows after the first Create an Account at https://secure.ssa.gov/IRL/SI-view.action. Once you create a new logon.gov credential, we will still need to complete the identity verification part, so you will need to provide some personal information to us. You will also receive an activation code from us to complete the process of creating your personal My Social Security account. You are given the option to select whether to receive your activation code by postal mail, text message, or automated voice phone call if you can verify at least one of these options. If you receive your activation code via text or phone call, you can finish creating your account right away. If you receive your code by mail, you will need to go back into www.ssa.gov/my account and select Finish Setting Up Your Account after receiving the code. After successfully creating your account, you are redirected to My Social Security Terms of Service screen prior to processing your account. No matter what type of device you use, the My Social Security portal will automatically readjust to fit the appropriate screen size, providing you full, easy-to-use access to your personal account. Next slide.
Okay.
Again, My Social Security. You can assist someone in creating a My Social Security account if they're with you, have their own email address, can answer the questions about themselves. But you cannot create a My Social Security account on behalf of another person by using another person's information or identity if the beneficiary is not in attendance, even if you have that person's written permission. Okay? Next slide.
Okay.
Okay, so what can you do with My Social Security account? Your online My Social Security account provides a wealth of information to help you and your family plan for your financial future. Okay, this gives you an idea of if you receive benefits or have Medicare, you can opt out, request. Okay, and again, you can get your 1099 from there. Okay, next slide.
Okay.
Again, My Social Security services. If you do not receive benefits, you can also review your retirement benefits estimates at different ages and dates when you want to start receiving benefits. You can view possible spouse benefits. You can request a replacement Social Security card if you meet certain requirements. Check the status of an application on appeal, Get a benefit verification letter as proof that you are not getting benefits. Get your Social Security statement to review, because sometimes estimates of your future retirement, disability, and survivor benefits, your earnings to verify the amounts that we posted are correct. And if they're not correct, you just forward us the 1099s, your 1040s, and W-2 forms, and we'll update it, make sure it's correct, and the estimated Social Security and Medicare taxes you've paid. Next slide.
Okay.
And you'll be seeing now a Social Security statement. The newly designed statement, in plain language, design and graphics makes it easier to find information. For example, we now provide a graph with retirement benefits estimated up to 9 ages, depending on when you want your benefits to start. Workers age 18 and older can access their statement online by using the Social Security, My Social Security. We mail a statement to workers age 60 and older who do not have an online account. Anyone can send in a written request to have a statement mailed to them. Next slide.
Okay.
And this is what it looks like. The newly designed statement. The statement is one of Social Security's most far-reaching educational tools. In 2022, we provided more than 38 million statements in print and online. And again, workers age 18 can access this statement on My Social Security. We mail a statement to workers 60 and older. And next slide.
Okay.
Then we have fact sheets. We show supplemental fact sheets based on person's age, work history, and statement to provide additional information helpful to make informed decisions. The fact sheets include 4 age-related fact sheets, the ages 18 to 48, 49 to 60, 61 to 69, and 70 plus. 4 earnings-related fact sheets for workers. And okay, learn more and review the fact sheets at ssa.gov, my account /statement.html. Next slide.
Okay.
And this is what the fact sheets look like for a workers from 49 to 60. Gives information different for everyone. It is earnings. And pretty much that's how it looks like. It'll give you, this is for your personalized one. And next slide.
Okay.
What's new in 2023? For 2023, the amount of earnings that will have no effect on eligibility for benefits for SSI beneficiaries who are students is $8,950 per year. The amount of earnings that we can exclude each month until we have excluded the maximum for the year is $2,220 per month. And for 2023, the monthly Medicare Part A hospital insurance base premium for less than 30 credits is $506. For 2023, the Part B supplementary medical insurance monthly base premium is now $164.90. Some people may be higher with higher incomes and will pay a higher amount. Okay, next slide.
Okay.
Good?
Yep.
Okay, then what else is new in 2023? Okay, substantial gainful activity, that's SGA. The SGA amount for persons with disabilities other than blindness is $1,470 per month in 2023. For persons who are blind, the amount of earnings that indicate SGA is $2,460 per month for 2023. And then trial work period months. The monthly earnings that we use to determine if the month counts as a trial work period month is $1,060 per month in 2023. And the federal benefit rate. For 2023, the supplemental, the SSI, is now $914 per month for eligible individual and $1,371 per month for an eligible couple. And the last slide is
Okay.
my information. Thank you, and I hope that I know it's a lot, And here's my information. So if anybody has any questions or want to contact me directly, this is my office number, my cell number, my email address, and I want to thank you for having me today. And here we go.
All right, thank you so much, Marcial. If anybody does have questions, please feel free to ask them using the either the chat or the Q&A. And let's see here. Let's I am currently receiving Social Security benefits. I am married. My husband still works. He is 64 and does not plan on accessing his Social Security benefits until 68. If he should die, do I qualify for part of his benefit?
Yes. If his is higher, you would get the higher amount.
Okay. Somebody says, can I get credit
If
for?
his is,
Yeah, go ahead.
go ahead, go ahead.
It's another question, but you can finish.
Yeah, just wanted to clarify that way. Just contact us if she's currently getting, and he, once he passes away as a spouse, as a widow, it'll be a widow. Then they would, if it's higher, like I stated, one of the slides, yes, it would be she would get the higher amount. So that's pretty much just to answer her question. Is that okay? Just ask her. It's okay.
Okay. Can I get credit for 15 years of being at home raising 2 children to boost the 35-year income average?
Okay, here we go. The question to her, okay, she said 15 years. So did you work the prior 15 years? You're going to get credit for any 10 years. It doesn't matter if you worked in 1965 to 1975 and you did 10 years of work and you earned 4 credits for each year. You got the 40 quarters there. If you haven't worked since, we're going to go back to those years, and that's how we're going to calculate what you're entitled to. And anything you worked afterwards, we're going to take the highest of any of those years. Does that make sense?
Okay. We'll wait and see if there's a response. If my Social Security benefit is less than 50% of my spouse's benefit, may I receive the difference?
Okay. What happens is if yours is higher, if yours is lower, and because percentages, it depends on what they make and what the case may be. If yours is lower, and let's say you're entitled under yours $400, hypothetically speaking, and you would get $600 under his, well, we'll give you the difference. You get the $400 from yours and the $200 from his. Just to keep it in a kind of general factor here.
All right.
Make sense?
See.
You good?
Yep. Do you have? So it says there's a couple questions ago. The highest of which years? I thought you said Social Security averaged 35 years of work.
Right. They take the highest of all those years. The highest of those years, the highest, it looks like 15, or is it the highest of the years? You got to have more than 10 years of work, because you got to have 40 quarters, and there's 4 quarters to a year. So they estimated that the highest of 35 years. So if you have 40 years of work, they're going to take the highest 35 years and then calculate it that way. If you have 10 years, it's going to go that way. It's going to be lower. So if you have 15 years, again. But if you have 40 years of work or 50 years of work, they're going to take 35 of those.
And do those years have to be consecutive?
No. You can sporadic, like I said before. If the lady, she says she hasn't worked in 15 years. Let's say you worked in 1973 to 1983. Then you didn't work 83 to 95 because you were raising children. Then you started working in 95 and on, to present. Then those years are going to count. As long as you have 10 and more years throughout your whole life.
Do you have to sign up for Medicare Part B if you are age 65 and still working full time?
No, what you can do is if you're still working at age 65, you want to apply for the Part A because it's free. The Part B, again, there's the general enrollment, there's the initial enrollment permit at 65. If you don't take it at that point. Part B, you can always take it later, as long as you have insurance covering you from when you turn 65 to when you want to take Part B. Let's say you're at 65, you have insurance, you're working, you got your insurance, okay, you don't need to take Part B. You take Part A, it's free, you get Part A, okay, you don't take it, Part B. Then let's say the next year you're going to retire, your insurance stops. At that point is when you want to apply, and that's when you get those two forms that I said. The L564, which is the form that'll say, yes, you were covered from age 65, whatever you turned, let's say June of 2022, and to present. So that covers that, because if you don't have coverage during those periods, your premiums for Part B will be higher. That's how that works. That's the reason why they have that in general enrollment period, the special enrollment period, and the initial enrollment periods. That make sense?
How do you update your address with the Social Security Administration if you are not receiving benefits, or is it just pulled from the tax information every year?
It's pulled from the tax information because you're not getting any benefits from us. So there's no record. We don't hold records like that. It would be from the IRS, yes.
All right. My retirement age is deemed to be 67. Can you determine what Social Security benefits will be depending on your age prior to 67?
Correct. Yes. You create my account. You can go on my account and give you an idea. I'll give you each month. It'll break it down for you what you can get at 62, then 62 in 1 month, and thereon. It'll tell you what you would be eligible at 62, what you'd be eligible at 66 before retirement age. It'll break it down for them. So you can come into your local office. It's called the Matrix, and they break it down for you also. But creating my Social Security account would be great because you see everything there, how much your earnings and so forth and so on. Okay?
I will be 65 years old later this year and plan to work until 66. Do I need to apply for Medicare before my 65th birthday, even though I will still be working?
And again, like I answered before, at 65, if you're not going to take the retirement, you want to apply for the Part A at least. So you can just apply and refuse the Part B at that point.
I just filed for Medicare this morning, assuming that it would begin on April 1st, since my birthday is in April. From the information this morning, do I understand that it will start next month in February?
When's your full retirement age? What did they say?
They said that they just filed for Medicare this morning, assuming
Right.
it would begin on April 1st, since my birthday is in
Right.
April.
So it would be April. It would start on their birthday, the month the birthday, yeah. It doesn't start before. She applied. Remember, we tell you 4 months, apply 4 months before, so that way you can get it as soon as you start with when you turn 65.
Let's see here. Yeah, the 15-year question was if child rearing could boost your benefit if you weren't working, but if you got credit for raising children. But that's not.
No, you don't get. You only get credits for anything you pay taxes on. If you're no, yeah, no.
Somebody says that I'm having problems signing in. I did not think I had an account, but it is saying I do. I cannot get in. Do you have any recommendations?
You can just contact your local Social Security office and they can boot you, send you a new password or whatever the case may be. They can help you with it.
Has the Social Security Administration ever been hacked?
Have you ever been hacked? I don't get into questions like that. I'm just talking about general stuff right now.
Husband was married for 10 years prior to our marriage. We have been married for 16 years. Can both spouses make a claim for spousal benefits?
If the other spouse didn't divorce, yes. I mean, if the other spouse didn't remarry. If he was married to the other spouse for more than 10 years, she can apply. If that's what she's asking.
Is there a way to review the Medicare applications once it has been filed?
You get a receipt. You should indicate whatever you're going to put in the system. It's going to automatically give you a receipt. It reviews and lets you look at whatever you put in.
Alrighty, I don't see any more questions, so I think we can go ahead and end it there. If you have more personal questions or if you would like some more
Yeah, they can
clarification,
contact me. That's not even a
please,
problem. Yeah,
please
by all means.
contact him at any of the phone numbers on the screen or had his email address there. So,
Correct.
and I just have to say, Marcial, thank you so much for presenting today.
You're welcome.
And thank you for everybody attending. And everybody just be safe, be well, and hopefully we will
How
see you
many
at another
attendees do
program.
we have? How many
I think
attendees do we have?
we had 39.
Okay, thank you. All right, my pleasure. All right, I'm here for you, and anything, you got my number, you got my information, and then that's it.
All right. Thank you so much.
You're welcome. Stay safe, everyone, and Happy New Year. Take care.